If your ribs are still popping out like this postpartum, it can really mess with your core's ability to function, which can roadblock you from getting to your results, whether that is flattening your belly, healing ab separation, pelvic floor dysfunction, etc. A lot of people assume that rib flare is just a posture issue, so tuck your ribs in, get stacked, and like that's fixing rib flare. But really, rib flare is also a muscle coordination problem that needs to be addressed. So during pregnancy, our ribs flare to make room for baby, which changes our breathing mechanics, which changes how our core is functioning. And if our ribs don't come back in and that system doesn't get reset postpartum, our ribs can stay stuck, flared, and then we're in this suboptimal pattern for our core that's roadblocking our healing unless we retrain the system. So how do we retrain the system? Well, first we need to restore diaphragm and rib mobility. We do this through breathing techniques. But we also have to address the obliques, because the obliques pull the ribs in and can create abdominal tension for us to help reduce that rib flare. The intercostal muscles, which are in between our ribs, help control rib expansion and recoil. So we need to address those as well. And then addressing the deep core and pelvic floor relationship and strength to keep everything stacked while we're in motion. Because when your ribs are moving better, you're managing pressure in your core better. And if you're managing pressure in your core better, your core can finally do its job easier in and outside of the gym, which will take you to your results, whether it's aesthetics, function, healing DR, pelvic floor symptoms, etc. So this is how you actually fix it.